conditions.
Today we are going to be reacting to fungal acne, or Malassezia Folliculitis. It is important to differentiate fungal acne from traditional acne. It is common to see in clinics where you guys are self-treating fungal acne or actually having traditional acne. The main point of this video is to try and help you avoid any potential complications that can arise from a misdiagnosis. So I just wanted to help you further differentiate between traditional acne and Malassezia Folliculitis, or Malassezia Folliculitis. All of us get to experience acne at least once in a lifetime. We all understand that modern times have evolved and the lifestyles and changed the dietary habits has affected hormonal levels in a very negative way. People are more prone to get acne. Now, we are discussing a widely spread yet quite ignored and unnoticed kind of acne, which is fungal in origin. Before describing fungal acne in depth, one must have a clear understanding of what it really is. As we all know, acne is a local or generalized skin condition in which either black, white, or red spots appear on face and neck region. Generally, the ages being affected by acne are teenagers and young adults between the age of 12 to 25. While we understand that acne has different types based on its origin and location, we have one rather unique type, which we call it as fungal acne, though there is no theoretical term existent for now. It is fungal in origin and is usually caused by Malassezia Furur, which is pretty much found everywhere and is a reason for Malassezia Folliculitis. Malassezia Folliculitis isn't an acne. It is actually a yeast that colonizes the hair follicle and causes inflammation, anytime you see the word itis. It actually means inflammation of the word that's in front of it. So it's an inflammation of the follicle, or Malassezia, or Malassezia is actually the name of the yeast that colonizes or causes the problem in the hair follicle. Malassezia folliculitis actually blocks the follicular openings alongside hyperactivating sebum glands, which increase sebum production. Malassezia overgrowth triggered by the blocking of the follicular opening and increased sebum production, which is more common during puberty with surge of testosterone, recent urge of antibiotics, or corticosteroids. One must wonder how Malassezia Furur, a small fungus, can do this much harm. It has its own mechanism of working, where the underlying yeast creates an opportunistic environment for fungal growth and tends to create an infective agent, which leads to diseases similar to those caused by yeast infections. Once the person is exposed to the infection, the acne spots appear more as monomorphic follicular dome-shaped papules and pustules generally present on the upper portion of trunk and face of young middle-aged adults. One may wonder what could be the possible difference between acne and fungal folliculitis. To dig out the differences, acne is usually not very itchy, whereas fungal folliculitis usually itchy. Acne itself is a process that is primarily comedonal in origins, so it's also a disease of too much oil, but the primary lesion is a comedone. You tend to get inflammatory lesions, which are red bumps, what we call papules, pustules, which are red bumps with white tops on the heads, nodules, and cysts, and you often get any number of different inflammatory lesions with acne at any one time. Now let's switch over to fungal acne. This tends to cause tiny spots which we call monomorphic, which basically means that they all look the same. So this is not the variation that you see in acne, where you get these papules or pustules or nodules and cysts which all look different to each other. These are tiny monomorphic lesions, and they tend to affect areas again where there's lots of oil glands like forehead and the temples, so lots of these tiny little red dotted lesions scattered over those oily parts of the skin. On the body, it can tend to affect the V of the chest and the same on the back the areas. Under the microscope, one can see fungal hyphae, which is a characteristic difference with acne. Skin scraping is a simple procedure done in clinics to identify fungal elements. Now we will see what treatment methods to overcome fungal causing of Malassezia folliculitis. To cure fungal acne and mainly Malassezia folliculitis, both oral and topical treatments are available. The infected person is usually given azole antifungal medication to treat the infection. 2% ketoconazole cream twice daily application gives rapid resolution for folliculitis. Mean response time is 4 weeks. This is the best option for uncomplicated fungal acne. Iconazole cream and mecanisole cream are commonly used antifungals, but studies have shown that there are poor results with iconazole solution and meconazole cream compared to ketoconazole. 2% ketoconazole shampoo is prepared for scalp dandruff. It can be used in face. If you're unable to get ketoconazole cream, gently apply over face and keep it for 5 minutes. What else can we use? Sulfur is another commonly used agent for fungal acne. You can apply it over face 2 to 3 times per week. Allow it to dry for 5 minutes, then rinse off. 2% salicylic acid helps to clear up fungal acne along other treatments. 2% selenium sulfide shampoo can apply over face and body. Leave it for 10 minutes for 3 consecutive days, then once weekly for mild form of fungal acne. For severe disease and poor response to topicals or extensive fungal acne, systemic therapy is often considered more effective than topical treatment, based upon the concept that systemic therapy may eliminate Malassezia deep within hair follicles. Itraconazole 200 mg taken orally daily for 1 week is adequate for most cases. Oral antifungal agent itraconazole gives the speediest resolution of problems. Usually by the time someone presents with quite extensive or significant acne, we want rapid resolution of their symptom. The azole group of medications can sometimes cause tummy aches and are broken down by the liver, so it's important to take a good history and ensure that the patient is suitable for this kind of medication. Overall, the topical ketoconazole with other supportive treatment is adequate for treatment, but in many cases, reoccurrence has been observed, which can be effectively treated with prophylactic treatment. To protect one from such an infection, proper hygiene should be maintained, and effective and timely treatment should be sought. You can use topical treatments once a week as a prophylactic along with your routine care to prevent reoccurrences. I hope this has made it seem clear how to diagnose fungal acne, what the differences are when compared to regular acne, and how to go about getting a handle on it. Thank you for watching. Make sure you subscribe to my channel. See you next time. Bye!